So two more speakers. We're privileged to have Michelle Zamperetti, Manager of Community Health Programs for Healthymagination GE, and Katie Lovis, Director of Corporate Responsibility, Communications and Government Affairs for GlaxoSmithKline. And I think Michelle's going to start. Yes?
Well, thank you so much for having me. I'm Michelle Chuk Zamperetti, and I do represent a traditional company in a very non-traditional role. I will talk today a little bit about the community-based solutions that we are putting into place at GE domestically. But I will be the first to say that we did not design these programs, nor did we conceive of this effort in an effort to address health equity. I think over the last 5 years, since the program has began, things have changed, and we'll talk about that a little bit more. I come from a 20-year career history in nonprofits in public health, and was hired at GE a little over a year ago to run what we call the Healthy Cities Initiative. Our Healthy Cities Initiative really started as a brainchild of our CEO, and I work, before I get into the purpose of my program, I work in a very non-traditional role. As I said, at GE, we, over the last 2.5 years, have actually started a Ventures in Health team. And if you were to hear our CEO, Jeff Immelt, speak, he would say that he wants GE, a 150-year-old company, to be the largest technology company in the world. And if you've seen any of the Owen commercials on TV, you know that this whole idea of a digital industrial future is where the company is pivoting and is heading in the next 5 years. And so, as one of the only public health professionals in the 400,000 person company that is GE, I represent Healthymagination, which was really designed to challenge the status quo of healthcare quality, to unlock the value of what GE brings as a 150-year-old company to this idea of the new next, and to change the way that the world is working. And I believe that the health equity conversation is critical to the future of health outcomes, and certainly of what a company like ours can do. And to David's point earlier, anchor companies like ours have a responsibility in this conversation. And so I feel very privileged and honored to play this role. So Healthymagination is where I sit in the company that's under GE Ventures in Health, and it is not technically part of either our corporate social responsibility, our foundation, or our benefits program. It is also not a part of the healthcare business. So it allows us both a little bit of flexibility, a lot of creativity, and the opportunity to ask for forgiveness and not for permission when we do things. I would say that when GE Healthy Cities was envisioned, and again, this was about in 2010. I'll get to that a little bit more. Sorry for the font here on this slide. Translation didn't work so well. We really were designed in thinking about improving health and productivity, primarily from a cost of healthcare perspective, but really understanding in a very different way from our leadership at the highest level that it is a business imperative for anchor organizations, for communities to really have the largest players at the table to truly make decisions about overall healthcare outcomes. And that if you improve the health of an entire community, regardless of where those people may live, work, or play, you're actually going to be raising the quality of all boats. So rising tide lifts all boats. However, it's a conversation that has been difficult to really get traction at the highest levels, to say this is not just about cost. And I think over the last couple of years, especially since I've been part of the team, we are really starting to make some headway in that direction. So again, a little bit of a short history of our program. The goal was to look at what a company like ours can do with a 150-year history to take the impact of all of the environmental considerations that were going on at the time, the recession, the significant increase of healthcare costs, the Affordable Care Act, and make a commitment to improving health of communities in which we had a large population of employees, beneficiaries, and retirees, recognizing that not all of those people are inside the four walls of any one of our offices. Certainly, over the last 10 years, like many large companies, we've put into place quite a significant and expensive wellness program. And we can spend a lot of time talking about the value of wellness programs at another time. But we know that if you don't have the benefit of learning about that wellness program inside a company, you don't get to take advantage of it. And there's far more people in the community that are able to take advantage of programs like these that we've put into place as a result of thinking differently about what it means to be a community partner. We started in Cincinnati. That was, at the time in 2010, our largest footprint community, where our automotive business is located. We thought about that prior to my involvement in this program, really with a reframing of healthcare benefits. And that did not at all take into account the public health impact of change. That was really about financing change and healthcare delivery change. We were able to do a study on the impact of that change in healthcare benefit delivery, and we did see some improvements. We moved all of our employees and beneficiaries to primary care medical homes, and we did see significant reduction in certain types of illnesses and hospital readmissions, but to us and certainly to the team now, that wasn't enough. We moved to Erie and Louisville in 2012, and we started really looking at what does it mean to do collective impact, and what does it mean to take into consideration the needs, the diversity, and the concerns of the community. And just in 2014, we really have moved into Houston and taken a totally different approach, which is really a community-based, grassroots up approach to making change. And certainly, if you compare the city of Cincinnati to the city of Houston, you will know that they are very, very different. Houston is, from time to time, the fourth or the third largest city in the country with significant health and healthcare outcomes issues. Certainly a very diverse city, 4.5 million people, and we are trying very hard to make sure that we're thinking differently about how to engage in a city of that type of size, scope, and we think that if we are able, as one of many community members, to see health change in any population within the community, but certainly focusing on areas where there is significant diversity, that we will be able to start talking about this and scale this to other places globally. Let me see. I just want to say that, again, back to the anchor company, or anchor organization concept, we believed that we could really bring the business process rigor that we have utilized for all of our programs across our history to something that was new and different. And that's why it became an imperative of our leadership to think about the idea of community health improvement, population health improvement, in a way that wasn't focused solely on our foundation work or our community benefits work, or that was outside of the idea of kind of the foundational support that we'd always given to communities to do corporate responsibility. And that's really where the shift in focus changed. So very quickly, in the beginning, the Cincinnati residents had the highest healthcare costs in the United States among the cities that we had large populations in. People were certainly not getting their money's worth, and our particular population was very unhealthy. We instituted a triple aim approach, again, focused solely on healthcare, not thinking much about the population or public health efforts. And we did see over a 3-year period some significant results. Those results are still being shown to have had impact. And not only that, but this top-down approach, though it was unique for us at the time, has grown in the community to be something that's not just a GE, P&G, Kroger business case, benefits issue, improving health of their own employees, but has actually become and spread into a community-based collaborative that's become its own organization that is focusing on looking at the needs of the community through collective impact approaches and really starting to implement and address challenges that face far more people than those that are just in the walls of the corporate organizations engaged. In 2016, they'll be focusing on birth outcomes and maternal health. And so I think that we're really starting to germinate a seed of issues that have far more relevance to far more people. In Louisville and Erie, they looked at Cincinnati and said, we like this. We think this is important. We like the fact that GE as one company of several that care about this issue want to sit at the table as part of these public health collaboratives where companies have not necessarily ever sat before. And I'm certainly not speaking of all companies. There are many organizations out there that are vested and care a lot about the work, about the health of their communities. It's a pipeline issue. It's a workforce issue. It's certainly a cost issue. And in my humble opinion, people are not getting healthier on their own. So there does have to be interventions that we have to figure out, and maybe corporate assistance will help do that. But Louisville and Erie said, we want to do this, but we don't want to do it in the same way that they did it in Cincinnati. We don't want to focus on benefits. We want to get more community engagement. We want to talk more honestly about the needs of the community, and we want to put our time and resources and personnel into supporting the needs of the communities, regardless of whether or not those people actually work for us or not. And so both Erie and Louisville created collaboratives, and those communities have worked on health data transparency, have worked on health literacy, smoking cessation, obesity management and prevention. And again, they start where they are within their office and an organizational space, but they are not limiting it to that. And they're really trying to figure out ways to spread their message, to do their education outside of the walls of their corporate offices. And in Houston, I think we're taking the most ground-up approach. As I said, we're really testing other ways to do business. We are working with the Texas Medical Center, again, large institutions in the city of Houston who have the largest employee populations, but also the sickest employee populations, 57 hospitals, 75% of which employees are obese or overweight, and starting to work with them on obesity management programs that can be managed inside their workspaces at the hospital, but also outside in the community. We're working with the Clinton Health Matters initiative out of the Clinton Foundation to really leverage and support the goals and objectives that the city of Houston came up with in early 2014, things like improved access to food, improved built environment policy decisions, reduction of food deserts, opportunity to everything as small as reducing or improving the quality of food at the Houston Rodeo to taking on a policy discussion like changing the way that schools have access to food services throughout the whole Houston Public School District. And we're looking at things that really require some specific boots on the ground, like getting all of the health institutions, whether it be a hospital, a provider, an imaging center, a jail, a psychology office connected to the health information exchange. Currently, about 50% of hospitals and 25% of providers of all types in Houston are connected to the brand new health information exchange. But in a city like Houston, there's really belief that if we can get over 75%, a real critical mass of providers connected to that exchange, there can be savings of up to $10 million a year in reduction of costs, reduction of duplication, improvement of care. And that's not only going to be for those people who are able to get to the doctor because they follow and utilize a primary provider regularly, but we're really thinking about it from this public health lens of what is a public health information exchange, not just a health information exchange. And finally, this year we're kicking off what we're hoping will be a 3-year pilot program to not only look internally at what we've done over the last 5 years, but to really assess the landscape and invite other companies, corporations, and collaboratives to come together to teach each other about how to do this in communities. Public health and the public health community has been excellent for the last 100 years in figuring out how to work together across the sectors to make meaningful change and improve overall health outcomes. However, companies, corporations, and organizations with resources are often not at that table, not because they are not invited, but because they don't know how to speak the language. And that's a language problem for both sides. And we think that more and more companies and corporations are interested in these conversations, and more public health discussions need to have these people who have resources at the table to truly make a difference. And so we're hoping to launch a leadership program that would take place over the course of the 2017 year to develop a cohort that brings together cities and communities, that are interested in working with business leaders within their community to really say, hey, what are our true problems? Not what are our problems inside the offices of GE, inside the offices of 3M or Exxon, but what are the true community health problems? And how do we think differently about putting our energy towards improving those problems? And I think that some of the speakers from this morning from today really got me thinking about maybe it's not the individual implementation of the program that you might want to think about, but it's about making sure that it's equitable and available in a way that is across the board, not just to a specific target community. And I think that type of data is really going to be valuable to us as we move forward. Again, we don't know everything. As a matter of fact, I feel like we know pretty much nothing. But if we put a lot of smart people in the room together, with a different type of driver, which is the people in the room who have money, maybe we can see some real continued change. So I would say that GE Healthy Cities Now, perhaps with the inclusion of a public health person on the staff, though I'm not sure, has an active engagement within health and public health community to address the critical health problems and inequities in health outcomes in an effort to develop programs and services that will support a community in achieving high quality health for all. And to me, our intervention is still nascent. We're still figuring it out. We have a staff of 1.5, maybe, on any given day. But we're getting attention, and I think that that's part of the solution, is to think differently and to be willing to recognize what we don't know and talk to the people out there who do know, and make sure that the right voices are being heard with the right type of support and sustainability behind them so that differences can truly be made over time. So again, I won't make the argument that we came to this from a health equity lens, but I certainly think that as we have flattened out our approach and as we've started to think much more broadly with partnerships in every sector, whether it be juvenile justice or education or health or healthcare, that the health equity conversation has become more and more prevalent at the table. And I certainly hope that that conversation continues. So thank you very much for having me. And I think we have another speaker before there are questions.